Which cells are primarily targeted by the human immunodeficiency virus, HIV, in the body? A. Red blood cells. B. CD4 positive cells. C. Stem cells. D. Platelets. Correct answer. B. CD4 positive cells. Rationale: HIV attacks the body's immune system, specifically targeting CD4 positive cells, also known as T helper cells. These cells are vital for the immune response, coordinating the body's defense against infections. The destruction of these cells by HIV leads to a weakened immune system, making the body more susceptible to opportunistic infections and diseases. In which of the following bodily fluids is the human immunodeficiency virus, HIV, not transmitted? Select all that apply. A. Breast milk. B. Blood. C. Tears. D. Semen. E. Vaginal fluid. F. Sweat. Correct answers: C. Tears, and F. Sweat. Rationale: HIV transmission occurs through bodily fluids such as blood, semen, vaginal secretions, and breast milk, where the virus is present in significant amounts to cause infection. However, tears and sweat have not been found to contain sufficient quantities of the virus to facilitate transmission, except in rare cases where these fluids are mixed with blood. Which statement below is not true regarding the role of the helper T cell? A. The helper T cell releases cytokines to help activate other immune system cells. B. The helper T cell is part of the adaptive immune system. C. The helper T cell is cytotoxic and kills invaders. D. The helper T cell has CD4 receptors found on its surface. Correct answer: C. The helper T cell is cytotoxic and kills invaders. Rationale: helper T cells play a crucial role in the adaptive immune system by releasing cytokines that activate other immune cells, aiding in the body's defense against pathogens. They possess CD4 receptors on their surface, distinguishing them from cytotoxic T cells, which directly kill infected cells. Helper T cells do not exhibit cytotoxic activity. Instead, they facilitate the immune response through signaling and coordination. Identify the correct statements about the anatomy of the human immunodeficiency virus, HIV. Select all that apply. A. HIV is a retrovirus. B. Inside the virus is packaged DNA. C. The protein projections found on the virus surface play a key role in attaching to the receptors on the helper T cell. D. The glycoproteins, specifically GP140, are vital for engaging the receptors on the targeted cell. Correct answers: A. HIV is a retrovirus, and C. The protein projections found on the virus surface play a key role in attaching to the receptors on the helper T cell. Rationale: HIV is a retrovirus characterized by its RNA genome, contradicting the incorrect statement that it contains DNA. The virus uses glycoprotein GP120, not GP140, for binding to CD4 receptors on helper T cells. This binding is crucial for the virus's entry into cells, facilitated by the protein projections on its surface that target and engage with specific cellular receptors. During the life cycle of HIV, what coreceptors are also targeted for entry into the cell? A. CCR5 or CXCR4. B. CD4 or CD2. C. CCR4 or CXCR5. D. CD8 or CD5. Correct answer: A. CCR5 or CXCR4. Rationale: the initial attachment of HIV to the host cell involves the binding of the viral envelope glycoprotein GP120 to the CD4 receptor on the surface of the target cell. Following this binding, additional interaction with coreceptors CCR5 or CXCR4 is necessary for the virus to gain entry into the cell. These coreceptors play a critical role in facilitating the fusion of the viral membrane with the cell membrane, allowing HIV to enter the host cell. What step in the life cycle of HIV does the human immunodeficiency virus, HIV, become united with the targeted cell and release its contents into that cell? A. Integration. B. Fusion. C. Budding. D. Assembly. Correct answer: B. Fusion. Rationale: Fusion is the critical step in the HIV life cycle where the virus effectively merges with the host cell's membrane, leading to the release of the viral RNA and enzymes into the cytoplasm of the cell. This step is pivotal for the subsequent replication and integration of the viral genome into the host DNA, facilitating the production of new viral particles. Fusion is enabled by the interaction between the viral envelope proteins and the host cell receptors, including the CD4 receptor and either the CCR5 or CXCR4 coreceptors. Which statement below best describes the role of reverse transcriptase? A. It's an enzyme that helps cut up the long protein chains of HIV. B. It plays a key role in the maturity of the virus. C. Reverse transcriptase is an enzyme that turns viral RNA into viral DNA. D. Reverse transcriptase is an enzyme that allows the viral DNA to become part of the cell's DNA. Correct answer. C. Reverse transcriptase is an enzyme that turns viral RNA into viral DNA. Rationale: reverse transcriptase is crucial in the HIV life cycle, converting the virus's RNA genome into DNA. This process is essential for the integration of the viral DNA into the host cell's genome, allowing HIV to replicate within the host cell. Unlike the other options, reverse transcriptase does not cut protein chains or directly integrate DNA into the cell's DNA. Those roles are performed by other enzymes. Once inside the nucleus of the cell, the human immunodeficiency virus, HIV, needs to become part of the cell's DNA. To do this, the virus releases an enzyme called blank. A. Protease. B. Reverse transcriptase. C. Kinase. D. Integrase. Correct answer. D. Integrase. Rationale: integrase is the enzyme that facilitates the integration of viral DNA into the host cell's DNA, a critical step in the HIV life cycle. This integration is essential for the viral DNA to be replicated along with the cell's DNA, leading to the production of new virus particles. What enzyme is responsible for cutting long chains of virus to help prep the HIV for maturity? A. Integrase. B. Protease. C. Reverse transcriptase. D. Kinase. Correct answer. B. Protease. Rationale: protease plays a pivotal role in the HIV life cycle by cleaving newly synthesized polyproteins into the mature protein components of the virus, necessary for assembling new virions. This process occurs in the late stages of the viral life cycle, preparing the virus for release from the host cell. During the acute stage of HIV, which findings below correlate with this stage? Select all that apply. A. CD4 level less than 500 cells/mm superscript 3. B. No presence of opportunistic infections. C. High viral load. D. Patient reports flu-like symptoms. E. Patient is asymptomatic. Correct answers: B. No presence of opportunistic infections. C. High viral load. And D. Patient reports flu-like symptoms. Rationale: the acute stage of HIV, occurring shortly after infection, is marked by a high viral load and immune response that may manifest as flu-like symptoms. CD4 counts typically remain above 500 cells/mm superscript 3, preventing opportunistic infections at this early stage. Patients may present with symptoms such as fever, sore throat, and fatigue, reflective of the body's initial response to the virus. What statements should you provide to a patient about the window period for HIV testing? Select all that apply. A. No test is available at this time to show immediate infection. B. The window period is the time from when you become infected with HIV to when a test can deliver positive results. C. Window periods vary depending on the type of HIV test administered. D. The absolute earliest an HIV test can detect HIV is about 3 months. Correct answers: A. No test is available at this time to show immediate infection. B. The window period is the time from when you become infected with HIV to when a test can deliver positive results. C. Window periods vary depending on the type of HIV test administered. Rationale: the window period refers to the time immediately following HIV exposure when current tests may not yet detect the virus or antibodies against it, with variability depending on the test type. The earliest detection can occur within days to weeks post-exposure, notably with nucleic acid tests, NATs, which can detect HIV much earlier than the traditional 3-month period mentioned in outdated guidelines. What HIV antigen does the combination HIV antigen/antibody test assess for?
A GP120.
B. P24. C. GP41. D. P35. Correct answer. B. P24 rationale. The P24 antigen is a protein component of HIV that can be detected soon after infection, before antibodies are made. Combination HIV antigen/antibody tests can detect P24 antigen as well as antibodies to HIV, allowing for earlier diagnosis compared to tests that only detect antibodies. Which HIV test can give the earliest test results? A. Nucleic acid test, NT. B. Antibody HIV test. C. Combination HIV antigen/antibody test. D. CD4 count. Correct answer. A. Nucleic acid test, NT. Rationale. NATs can detect HIV's genetic material directly and can provide the earliest detection of the virus, as soon as 10 to 14 days after exposure, making it the most sensitive and earliest option for HIV testing. A patient in the chronic stage of HIV has a CD4 count ordered. What does this test measure? A. Red blood cells. B. B cells. C. Cytotoxic T cells. D. Helper T cells. Correct answer. D. Helper T cells. Rationale. CD4 counts measure the number of CD4 T cells, helper T cells, in a cubic millimeter of blood, providing an indication of the health of the immune system in HIV-infected individuals. These cells are crucial for orchestrating the immune response and are the primary targets of HIV. What is a normal CD4 count? A. 200 to 500 cells/mm superscript 3. B. 1500 to 3500 cells/mm superscript 3. C. 500, 1500 cells/mm superscript 3. D. Less than 200 cells/mm superscript 3. Correct answer. C. 500, 1500 cells/mm superscript 3. Rationale. A normal CD4 count ranges from 500 to 1500 cells/mm superscript 3, indicating a healthy immune system. CD4 counts below 200 cells/mm superscript 3 are indicative of AIDS, signifying severe immune compromise. A 48-year-old patient is HIV positive, with no signs and symptoms, a CD4 count of 400 cells/mm superscript 3, and no opportunistic infections. These findings correlate with what stage of HIV? A. Acute. B. Chronic. C. AIDS. Correct answer. B. Chronic. Rationale. These findings align with the chronic stage of HIV, characterized by the absence of symptoms, a moderately reduced CD4 count, more than 200 cells/mm superscript 3, but maybe lower than normal, and no opportunistic infections. This stage can last for years without progressing to AIDS if the patient is receiving effective antiretroviral therapy. Select the criteria used to diagnose a patient with acquired immunodeficiency syndrome, AIDS. A. CD4 count less than 200 cells/mm superscript 3. B. Presence of opportunistic infection. C. CD4 count greater than 1,500 cells/mm superscript 3. D. WBC 9500. E. Absence of opportunistic infection. Correct answers. A. CD4 count less than 200 cells/mm superscript 3 and B. Presence of opportunistic infection. Rationale. AIDS diagnosis is based on a CD4 count falling below 200 cells/mm superscript 3 or the presence of specific opportunistic infections, reflecting severe immunosuppression. This stage represents advanced HIV infection with significant impact on the immune system's ability to fight infections. A patient with AIDS has dark purplish-brown lesions on the mucous membranes of the mouth. These lesions correlate with what type of opportunistic disease? A. Epstein-Barr virus. B. Herpes simplex virus. C. Cytomegalovirus. D. Kaposi's sarcoma. Correct answer. D. Kaposi's sarcoma. Rationale: Kaposi's sarcoma, a type of cancer that forms in the lining of blood and lymph vessels, manifests as dark purplish-brown lesions on the skin or mucous membranes, including the mouth. This opportunistic disease is commonly associated with advanced HIV or AIDS, where the immune system is severely compromised, allowing for the development of such malignancies. What sign and symptoms in a patient with HIV indicate the disease is worsening and the immune system is severely compromised? A. Open, oozing lesions around the mouth. B. White hair-like spots on the side of the tongue. C. Cheesy white film on the tonsils and inside cheeks. D. Vision changes. Correct answer. B. White hair-like spots on the side of the tongue. Rationale: oral hairy leukoplakia, characterized by white hair-like spots on the side of the tongue, signals a severely compromised immune system, commonly seen in advanced HIV infection. This condition is caused by the Epstein-Barr virus, which can become opportunistic when the immune defense is weakened. A patient with AIDS has developed CMV, cytomegalovirus. What is a priority education topic for the nurse? A. Avoiding exposure to cat feces. B. Drinking water from clean sources only. C. Scheduling an eye appointment. D. Isolating for 14 days to prevent transmission of CMV to others. Correct answer. C. Scheduling an eye appointment. Rationale: CMV can cause retinitis in patients with AIDS, potentially leading to blindness. Priority education should focus on the importance of regular eye examinations to monitor for signs of CMV retinitis, enabling timely treatment to prevent or mitigate vision loss. Your patient is in the last stage of HIV with a CD4 count of 100 cells/mm superscript 3. Which fungal infections is the patient at risk for? Select all that apply. A. Mycobacterium tuberculosis. B. Candidiasis. C. Coccidioidomycosis. D. Toxoplasmosis. E. Histoplasmosis. Correct answers: B. Candidiasis, C. Coccidioidomycosis, and E. Histoplasmosis. Rationale: patients with advanced HIV/AIDS and low CD4 counts are at increased risk for various opportunistic fungal infections due to their compromised immune systems. Candidiasis, coccidioidomycosis, and histoplasmosis are all fungal infections that can cause significant illness in these patients. Mycobacterium tuberculosis is bacterial, and toxoplasmosis is caused by a protozoal parasite, distinguishing them from the fungal infections listed. Which type of opportunistic infection occurs from inhaling a parasitic organism found in cat and bird feces? A. Histoplasmosis. B. Cryptococcosis. C. Mycobacterium avium complex. D. Toxoplasmosis. Correct answer: D. Toxoplasmosis. Rationale: toxoplasmosis is caused by the protozoal parasite Toxoplasma gondii, which can be found in cat and bird feces as well as undercooked meats such as pork and lamb. Ingestion or inhalation of the parasite's oocysts can lead to infection, particularly posing a risk to individuals with compromised immune systems, such as those with AIDS. You're providing education to a patient with AIDS on how to prevent opportunistic infections. Which statement indicates a need for further teaching? A. I'm traveling to Puerto Rico next week and will be sure to pack bottled water. B. I've switched to buying raw organic milk. C. Last month I received the Pneumovax. D. My neighbor bought a cat last week. Correct answer: B. I've switched to buying raw organic milk. Rationale: consuming raw, undercooked, and unpasteurized foods and beverages can significantly increase the risk of opportunistic infections in individuals with AIDS due to their compromised immune systems. Raw organic milk can contain harmful pathogens that are usually killed during pasteurization. What questions could the nurse ask to help identify a patient at risk for HIV? Select all that apply. A. How often do you use alcohol or drugs? B. Have you recently experienced an abusive relationship? C. If you are sexually active, do you or your partner use protection? D. In the past month, have you felt sad or unable to get out of bed? E. Have you ever been treated for a sexually transmitted infection? F. Do you ever experience intrusive or unwanted thoughts? Correct answers. A. How often do you use alcohol or drugs? C. If you are sexually active, do you or your partner use protection? E. Have you ever been treated for a sexually transmitted infection? Rationale. Screening questions that focus on sexual behavior, substance use, and history of sexually transmitted infections, STIs, are critical for identifying individuals at increased risk for HIV. These factors can contribute to behaviors that increase the likelihood of HIV exposure and infection. True or false? The CDC recommends that all people between the ages of 13 to 64 be tested at least once for HIV during a routine health visit, regardless of risk factors. Correct answer. True. Rationale. The CDC recommends that everyone between the ages of 13 and 64 get tested for HIV at least once as part of routine healthcare. This policy aims to ensure early detection and treatment of HIV, regardless of perceived risk factors, to improve health outcomes and reduce the spread of the virus. A 25-year-old patient engages in high-risk activities that could lead to an HIV infection, but is HIV negative. What preventive measure should the nurse educate the patient about? A. PEP. B. PrEP. C. Opportunistic infections. D. Nucleic acid test. NT. Correct answer. B. PrEP. Rationale. Pre-exposure prophylaxis, PrEP, is recommended for individuals who are at high risk for HIV but have tested negative. PrEP involves taking medication before potential exposure to prevent HIV infection, effectively reducing the risk when taken consistently and correctly. Which patient is a candidate for PEP, post-exposure prophylaxis? A 32-year-old patient who reports sharing 4 drug injection devices with a person who is HIV positive 5 days ago. B. A 28-year-old patient who engages in high-risk activities on a regular basis that could lead to an HIV infection. C. A 55-year-old who is HIV positive. D. A 30-year-old who was sexually assaulted 2 days ago. Correct answer. D. A 30-year-old who was sexually assaulted 2 days ago. Rationale. PEP is an emergency intervention for individuals who have recently been exposed to HIV, aimed at preventing infection. It must be started within 72 hours of exposure to be effective, making it suitable for the individual who was sexually assaulted 2 days ago. PEP involves taking antiretroviral medication for 28 days post-exposure. A 25-year-old female is about to deliver a baby. She is HIV positive and has been on antiretroviral therapy during the pregnancy. What steps can be taken to help prevent transmitting the virus to the baby after birth? A. Substitute formula for breastfeeding. B. Administer antiretroviral treatment to the newborn for 2 weeks after birth. C. Avoid kissing and hugging the newborn. D. Stop taking antiretroviral therapy for 2 months postpartum. Correct answer. A. Substitute formula for breastfeeding. Rationale. To prevent the transmission of HIV from mother to child, breastfeeding should be avoided because HIV can be transmitted through breast milk. Instead, formula feeding is recommended. Additionally, antiretroviral therapy should continue for the mother postpartum, and the newborn should receive antiretroviral treatment for 4 to 6 weeks after birth, not just 2 weeks. Physical affection like kissing and hugging does not transmit HIV and should not be avoided. Which statement about antiretroviral treatment, ART, is not true? A. The patient starts out taking 3 medications from at least 2 drug classes. B. ART decreases the amount of virus in the blood within about 6 months. C. ART helps decrease the risk of developing an opportunistic infection. D. Antiretroviral medications are taken when signs and symptoms appear and then tapered off. Correct answer. D. Antiretroviral medications are taken when signs and symptoms appear and then tapered off. Rationale. ART requires strict adherence to a daily regimen to effectively manage HIV levels and maintain immune function. It is not used only during symptomatic periods or tapered off. ART is critical for reducing viral load, decreasing the risk of opportunistic infections, and must be taken consistently regardless of the presence or absence of symptoms. Which class of antiretroviral medications bind with the CD4 receptors and inhibit the HIV's glycoprotein from being able to activate and engage the core receptors? A. Post-attachment inhibitors. B. Fusion inhibitors. C. Integrase inhibitors. D. Non-nucleoside reverse transcriptase inhibitors. Correct answer: A. Post-attachment inhibitors. Rationale: post-attachment inhibitors, such as ibolizumab, Trogarzo, act by binding to the CD4 receptors on the host cell, preventing the HIV envelope glycoprotein from engaging core receptors, thereby inhibiting viral entry into the cell. Chemokine receptor antagonists block the core receptor, blank, on the cell so HIV cannot engage the receptor and enter the cell.
A. CXCR4.
B. CD4. C. CCR5. D. GP120. Correct answer: C. CCR5. Rationale: chemokine receptor antagonists work by blocking the CCR5 core receptor on CD4 cells, preventing HIV from binding to and entering these immune cells. This mechanism stops the virus from infecting the cell and replicating within it. The patient is prescribed enfuvirtide fusion. The nurse prepares to administer this medication via A. Intravenous route. B. Oral route. C. Topical route. D. Subcutaneous route. Correct answer: D. Subcutaneous route. Rationale: enfuvirtide fusion is administered via the subcutaneous route. It is a fusion inhibitor that works by preventing HIV from fusing with the host cell membrane, thus inhibiting viral entry into the cell. Which antiretroviral medication treatment stops the enzyme reverse transcriptase from working by binding to it? A. Non-nucleoside reverse transcriptase inhibitors, NNRTIs. B. Integrase inhibitors. C. Protease inhibitors. D. Fusion inhibitors. Correct answer: A. Non-nucleoside reverse transcriptase inhibitors, NNRTIs. Rationale: non-nucleoside reverse transcriptase inhibitors, NNRTIs, act by directly binding to the reverse transcriptase enzyme, inhibiting its function. This prevents the conversion of viral RNA into DNA, a critical step in the HIV life cycle, thereby hindering the virus's ability to replicate. A patient with stage 2 HIV, chronic stage, is prescribed to take raltegravir. This medication belongs to what class of ART? A. Protease inhibitors. B. Integrase inhibitors. C. Nucleoside reverse transcriptase inhibitors. D. Attachment inhibitors. Correct answer: B. Integrase inhibitors. Rationale: raltegravir is classified as an integrase inhibitor, a type of antiretroviral therapy that blocks the HIV enzyme integrase. By inhibiting this enzyme, integrase inhibitors prevent the viral DNA from integrating into the host cell's DNA, a crucial step in the HIV life cycle. This stops the replication of the virus and helps control the infection. What group of ART for the treatment of HIV prevents an enzyme from cutting the long chains of the virus, thereby hindering the assembly and maturation of the virus? A. Protease inhibitors. B. Integrase inhibitors. C. Nucleoside reverse transcriptase inhibitors. D. Attachment inhibitors. Correct answer: A. Protease inhibitors. Rationale: protease inhibitors work by inhibiting the HIV protease enzyme, which is essential for cutting the long polyprotein chains into shorter functional proteins needed for the assembly of new virus particles. By blocking this process, protease inhibitors prevent the maturation of new viruses, thereby limiting the spread of HIV within the body. A patient with HIV is about to start antiretroviral therapy. Which statement by the patient indicates a need for re-education about these medications? A. If I take these medications as prescribed, my viral load will become undetectable and I have a low risk of transmitting the virus to others. B. Drug resistance is likely to develop if I'm non-compliant with my medications. C. I currently take a medication called St. John's wort to treat depression. D. This therapy does not cure me of HIV, but helps me live a healthier and longer life. Correct answer. C. I currently take a medication called St. John's wort to treat depression. Rationale. St. John's wort can significantly reduce the effectiveness of antiretroviral medications due to its impact on drug metabolism. Patients on antiretroviral therapy should be cautioned against the use of St. John's wort because it can lead to reduced plasma concentrations of antiretroviral drugs, potentially resulting in viral resistance or treatment failure. Patients should be educated about the importance of discussing all medications, including herbal supplements, with their healthcare provider.